pleased to be joined now by the ultrasound director at Beaumont Emergency Medicine, Dr. Amit Bahl, joining us today on the MegaCast. Dr. Bahl, thanks for being with us today.
Happy to be here.
Appreciate having you on. So recently you were the lead author of a study that indicates that emergency department visits and hospitalizations in fully vaccinated adults with breakthrough cases in Beaumont's hospitals were rare events, and when hospitalizations were needed for those immunized, it was for older patients with comorbidity. So that's the gist of what was found in this study. What prompted this to be studied all together? Was it because of the most recent surge in COVID-19? Was this something that began to be researched before Michigan went into this most recent surge due to the Delta variant?
So great question. We've had a lot of good data that's come out regarding the safety and efficacy of vaccination. And there were many studies that were conducted, tens of thousands of patients prior to the rollout of the vaccinations, which happened, you probably recall, end of last year, where it all started. But there's been very little real-world data on how the vaccine is in terms of effectiveness with just a general population. So how does this affect, my family, your friends? Is this vaccine truly effective in preventing severe disease? Is it truly effective in preventing, hospitalizations and severe illness? And that was the rationale behind the study.
We're joined by Dr. Amit Bahl, the ultrasound director at Beaumont Emergency Medicine, who recently led a study about emergency department visits and hospitalizations in fully vaccinated adults in hospitals and their situations with COVID-19 and breakthrough cases, and indicating that those were rare events. But that does bring up the question that there have been a lot of these breakthrough cases that have been reported lately. Each time the Health and Human Services Department records or provides their recorded COVID-19 cases, some of those that are reported do end up being breakthrough cases, and hospitals have seen a lot of breakthrough cases come through. Why is that the case? Because the whole purpose of these vaccines was to prevent severe illness, was to prevent severe symptoms of COVID-19 that then would lead to hospitalization. So based on your study, was there any information that indicated why hospitals were seeing so many of these breakthrough cases coming through?
Well, I think one of the key things to remember is that proportionately, we're talking about a very small percentage of breakthrough cases. So the vast majority of patients that are going to become infected with COVID have bad outcomes, long-term comorbidities. These are patients that are unvaccinated. So I think the effectiveness in reducing, I think the vaccine is doing what it's intended to do, and that's really reduce the amount of severe illness in patients. And so we're really seeing that. There are cases where there are breakthrough infections do happen, and there's cases in which those patients do suffer some severe outcomes. But what my study was able to kind of hone in on and really elucidate was that those patients tend to be older, they tend to be sicker to begin with. So their baseline level of illness is very severe, it's very high. And so even if you just looked at them without COVID, those patients, if they're coming to the hospital, they're a high-risk category to begin with. And so we know a lot of things about vaccination and developing an immune response, and we know that that's not as prominent in elderly patients. We know that's not as robust in patients that have comorbidities who are taking immunosuppressant drugs. And so yes, we do have a subset of our population that are fragile and are more susceptible to having these breakthrough infections. But let me be clear on the message, and this is a rarer circumstance. The vast majority of patients, even today, where Delta predominates the variant landscape here, the impact is really going to the unvaccinated patient. Those really bad outcomes generally is that category of patients.
We're joined by Dr. Amit Bahl. He is the ultrasound director at Beaumont Emergency Medicine with us on the MegaCast. And when we think about these breakthrough cases, as you said, it's a very rare occurrence. And to just be frank about it, from the onset of these vaccines being available, the whole point of them was not to prevent cases of COVID-19. There was never any indication from any of the vaccine providers, from the federal government, from the Health and Human Services Department, or any other medical organization thereof that had indicated that these vaccines would prevent COVID-19 cases. The entire point of these was to prevent severe cases, severe symptoms, hospitalizations, and ultimately deaths from COVID-19. A, so that, of course, we're not having unnecessary loss of life, and B, so that we're not overwhelming hospital systems. So it's expected, it should be expected to see breakthrough cases that is normal based on what vaccines we currently have against COVID-19 and their efficacy and what they do to prevent COVID-19 cases and deaths, or at least severe cases of COVID-19 and deaths. So them being rare cases, that's right on par with what we were to be expecting. Is that correct?
Yeah, absolutely. It's you're dealing with a small fraction of patients. If you look at my study itself, only 1% out of 12,000 ended up, as we had a breakthrough infection. So 129 patients, very, very small number that have kind of come through the hospital for whatever reason. Their baseline level of illness is high, and they're older, and they can have a severe outcome. It's not ruling out that possibility. The vaccine is not 100% effective. It's very, very good. At least a couple of the vaccines that we have available are very, efficacious. And nothing is 100%. Nothing is perfect. But it's a very, very good solution.
We're joined by Dr. Amit Bahl. He is the leader of a study through Beaumont that was based on fully vaccinated individuals with breakthrough COVID-19 cases, analyzing the results of those breakthrough cases, whether it be hospitalization and just identification of those cases in hospitals, hospitalization, severe cases, and the results were that these were rare events, and mostly among those that already had some comorbidities or were in risk factor categories, such as those of older age, that then had those breakthrough cases. And so that brings me to another interesting wrinkle now that we have in play, and those are the COVID-19 booster shots. Particularly the one that's available right now is the Pfizer booster shot, and over 50,000 booster shots have been administered to Michiganders ages 50 and older. Currently, it's available for those third doses are only available for immunocompromised Americans, such as those who have been involved in an organ transplant, or active cancer or HIV patients, and we're at least 6 months out from the 2-dose series. So in terms of this study and other studies going forward through Beaumont, or that you're aware of through other health systems that Beaumont may be participating in, what's to be expected with these booster shots? Do you believe, based on your current research, based on your knowledge and consultation with other medical professionals on the front lines battling COVID-19, that these booster shots will make these breakthrough cases and severe breakthrough cases even that much more rare, and for how long?
Yeah, this is a fantastic question. I would say this is more a speculative type of an answer rather than based in evidence, because we just don't have it quite yet. But so the question here is, do breakthrough infections, is that a consequence of perhaps waning immunity? So a number of us were vaccinated back in December, especially the healthcare sector, and now that we're sitting here in September, are the breakthrough infections due to the fact that we just have waning immunity, and our booster shots indicated. And at this point, I know the FDA is considering this and considering the evidence surrounding it, and hopefully there'll be recommendations forthcoming very, very soon regarding this. There has been approval of for immunocompromised patients and having that booster shot. And you're spot on. The whole idea is that we think the immunity wanes, and that having this additional booster will protect us from getting those breakthrough infections, particularly with those most vulnerable patients that probably don't have the same immune response to the vaccination in the first place.
We're joined by Dr. Amit Bahl. He is from Beaumont Emergency Medicine. He is their ultrasound director and was the leader of a study on breakthrough cases among patients that were fully vaccinated against COVID-19. Those rare occasions and the study did find that there were rare occasions, and that most of those severe cases and hospitalizations were among those that had some comorbidities or that were of older age, both risk factor areas that make COVID-19 that much more dangerous for certain populations and even those that are vaccinated in it. And of course, being that these cases are so rare, just a little moment of a devil's advocate play here, Dr. Bahl. With these cases being so rare, being rare events, with booster shots out there that theoretically should make these cases even more rare against those, and particularly for those that are immunocompromised or maybe in risk factor areas such as being an organ donor or a transplant recipient, someone that's currently a current cancer or HIV patient, and so on and so forth. If these cases are so rare and there are more protections that are coming into play, why should the general public be concerned about breakthrough cases? Why should they care?
Well, you should. I think that the part of this, part of the equation is caring about the breakthrough infections, but part of it is also about if you get infected, and in particular if you're unvaccinated, there's no really rhyme or reason why you might have a really bad outcome. So, we saw patients in our study that were very young, 21 years old that died, 19 years old that was on a ventilator. You don't have those same issues with patients that are vaccinated and having the breakthrough infection. So they typically have milder illness, unless they're in this category that's well-defined, that's relatively well-defined as being older and having comorbidities. And so, yeah, I mean, if you believe in vaccination and you feel that your vaccination or your immunity may be waning, then you don't want to have a breakthrough infection, because there is a possibility that you'll have a severe infection. If you're unvaccinated, then there's no rhyme or reason, and you have to recognize that bad outcomes are very possible. And the funny thing about it is, and I'm an emergency physician, and I see COVID patients quite frequently, especially in the last couple of weeks. I've been seeing a lot of COVID, unfortunately. And when I talk to unvaccinated patients and they're ill and they need to be hospitalized, and nobody ever tells me, it's they're excited about their condition and how they need to be hospitalized. Everybody expresses remorse. And so it's just about whether or not we can kind of make those decisions and prevent those types of visits. I think it's very, very powerful.
We're joined by Dr. Amit Bahl. He is the ultrasound director at Beaumont Emergency Medicine, with us on the MegaCast. And Dr. Bahl, today in a number of different local journalistic publications, the Detroit News, the Oakland Press, we posted an article. Well, we will post an article from them on our website at civiccentertv.com/coronavirus today. They talked about Beaumont's current ongoing situation with hospital capacity, particularly in emergency departments right now. It's not entirely COVID related. It's more just about a staffing issue. But that article did say a perfect storm is currently in place at emergency rooms. Many of them are full. Beaumont Health announced on Wednesday that all 10 of its emergency departments are nearly at capacity and are urging patients to consider all options for treatment and evaluate other options such as urgent care and their primary care doctor visits instead of going to the hospital when appropriate. Right now, to help bridge some of that capacity issue, and help our local physicians, our nurses, our other frontline workers at Beaumont's emergency departments right now, what more can be done by the general public to help relieve some of that stress so that, A, you can continue to do the great work that you're doing in your emergency departments, but also so that we aren't overwhelming our healthcare workers who have already had a tough go of it over the last 16 months plus with COVID-19 are going to continue to have a pretty tough road ahead as well as we go through the surge and through the uncertain future with this pandemic.
So it's a great question, and unfortunately you're exactly correct in terms of the issues that we're kind of facing, somewhat of even a crisis. The reality is that we only have X amount of functional capacity, and we're going to continue to do our best to take care of you. So if you have an emergency condition, or if you feel that you have an emergency, you come to the hospital and you get taken care of by, at one of our emergency centers, and we'll do what we can. The other options should be considered. If you feel that you have maybe perhaps a non-life-threatening condition or a more minor type of scenario, could this be resolved by, an urgent care or an acute care visit? Virtual visits are another potential option. So over the past, during the pandemic, these virtual visits have really skyrocketed and have been another, a technological really advance that's come through from this pandemic. So some patients would be great candidates for those types of visits. And then, of course, if you need to be in the emergency department, you'll get treated, and taken care of. So always better to be a little bit more conservative. It's not always clear to an individual what constitutes an emergency, and so definitely be more conservative on that side.
We're joined by Dr. Amit Bahl. He is the ultrasound director at Beaumont Emergency Medicine. Dr. Bahl, just another couple minutes with you today before we'll say goodbye. Is there anything else that would be important for our audience to know right now in terms of the COVID-19 front at Beaumont Hospital, how we can support our emergency medical and really all of our frontline medical professionals right now at Beaumont and other health systems, or anything else for us today?
I appreciate the opportunity to kind of talk through this study and some of the other things that are issues right now, particularly with staffing and so forth. And I think that, the study really, the point here is that the evidence now can guide us. If you live in Michigan, I really want to say thank you for those who have been vaccinated. Close to 5.2 million people in Michigan. That's commendable. You're fully vaccinated. Spread the news. Talk about your experiences. Do you feel safer? Do you feel like vaccination has been effective and helpful for you and your family? Hopefully you can have, somewhat of an impact on those that are on the fence or considering vaccination. Evidence like this, conversations with your community and your leaders are so important. And I think that the vaccination really is the right step in getting us out of this thing.
We're joined by Dr. Amit Bahl. He is the director he's the ultrasound director at Beaumont Emergency Medicine with us today on the MegaCast. And Dr. Bahl, we appreciate it. If people want to learn more about the study that was undergone at Beaumont about these breakthrough cases, where can they get more information or maybe access to study and see this information for themselves that was researched right here in our local area?
I'm sorry, you just cut out there at the end.
Oh, okay. We just have another minute or so with you here today, Dr. Bahl. We appreciate it. If people want to access the study, they want to read it themselves, get this information that was researched and compiled right here in our local community, and learn more about how breakthrough cases are affecting our fully vaccinated patients, and get that information for themselves from frontline workers who have been researching and put this reputable information out there. How can people get more access to this or even read the full study themselves?
Yeah, absolutely. It's an open access article, so it's available to the entire public to look at. You could go to thelancet.com. I know Beaumont has a link to it as well on their COVID site. So there's multiple different ways to get access to this study, and I encourage people, weigh the evidence, look at it carefully. I think it tells a very compelling story.
Yeah, another great way to access the study, support our frontline workers, support the fight against COVID-19, and support our local journalists as well, as to go to the Detroit Free Press's website at free.com and research an article called New Beaumont Health Study, COVID-19 Hospitalizations Rare for Fully Vaccinated. That is an article by Christina Hall that also has a direct link to the study from the link that Dr. Bahl had spoken about. Dr. Bahl, thank you for being with us today. Appreciate your insight and this really interesting information that should be alarming to some people as they go forward and maybe consider getting vaccinated, and be a little bit of a positive as well for people that are fully vaccinated or maybe are on the fence as they're looking toward potentially getting vaccinated against COVID-19, knowing that these cases are rare and mostly among those that are in risk factor groups. Thank you.
My pleasure.